Measles outbreaks at daycares. Health and economic impact on families. Measles outbreaks in daycares are sparking controversy and concern among parents, as the highly contagious disease poses significant health risks and logistical challenges. The recent case of a mother in Iowa highlights the complexities involved when a child is exposed to measles at a young age before they can receive the MMR vaccine. Public health officials are grappling with the need to balance the risk of exposure against the financial burden on working families, who may face weeks of quarantine and unpaid leave. As measles cases continue to rise across the United States, experts warn that daycares could become hotspots for outbreaks, putting vulnerable children at risk of severe complications. With no federal mandate for paid sick leave, parents are left in a difficult position, forced to choose between their child's health and their own financial stability. The situation has reignited debates around vaccination, with some arguing that parents who refuse to vaccinate their children are putting others at risk. As the controversy grows, one thing remains clear. The measles outbreak in daycares is a complex issue with no easy solutions, and it's sparking heated discussions across the country. Pima County Health Department's Measles Action: Mobile vaccines to protect students. In a proactive move to safeguard students from the highly contagious measles virus, the Pima County Health Department is intensifying its outreach initiatives as the back-to-school season approaches. Fuson, Eris, 13 News. Recent reports from the Pima County Health Department, PCHD, indicate that measles cases have emerged in both Navajo County and Maricopa County, with several neighboring states also grappling with outbreaks. Earlier this year, the Pima County Board of Supervisors took a significant step by approving a strategy to deploy mobile vaccination units to schools and child care facilities where the vaccination rates for measles, mumps, and rubella, MMR, are below the critical threshold of 95%. Alarmingly, health officials have identified 156 schools and child care centers in Pima County that do not meet this standard. While the majority of schools are compliant, those that fall short may be at a heightened risk for outbreaks. Crystal Rambaud, the immunization manager at the Pima County Health Department, emphasized the severity of the situation, stating, "It's extremely contagious. If you are exposed to it and you're vulnerable, you're very, very likely to become sick, and it can lead to very serious illness and very serious outcomes for certain people." In early July, the health department distributed surveys to the eligible schools, but so far, only a few have confirmed their participation. Many schools are still on summer break, and staff members are unavailable. Officials are optimistic that more schools will join the initiative as the new academic year begins, but they want to clarify that participation is optional. Schools that can demonstrate compliance through other means are encouraged to do so. The mobile vaccination units will be provided at no cost and no insurance is required. Students will only need parental consent and a medical screening to receive the vaccine. If a child does not have a vaccination record, health officials assure that it is still safe to start the MMR vaccination series. The PCHD is committed to ensuring that both schools and families have access to reliable information regarding vaccinations. The department is ready to engage directly with school staff and parents to address any questions or concerns they may have about the safety and effectiveness of vaccines. Even if your school is not part of the mobile unit program, you can still reach out to the Pima County Health Department to ensure your child's vaccinations are current before the school year begins. For further details on how to schedule a vaccination or to check your child's vaccination records, please visit the Pima County Health Department's website at https://pima.gov/2381/measles. You can also submit your breaking news or weather images through this link, https://www.ugc.zium.com/appgallery/album/452 and theme default. Copyright 2025. 13 News. All rights reserved. U.S. measles outbreaks. Why vaccination matters more than ever. The United States stands on the verge of forfeiting a hard-earned triumph against one of humanity's most contagious diseases. Measles cases have surged to a 33-year peak by mid-2025, alarming experts who warn this could signal the virus's comeback as a persistent annual threat. As of July 15th, health officials documented 1,309 infections, the highest count since measles was largely eradicated domestically 25 years ago. This resurgence stems primarily from declining vaccination rates, creating vulnerable pockets where insufficient immunity allows the virus to ignite explosive outbreaks. But here's where it gets controversial. Despite scientific consensus about vaccines, influential voices are now questioning established immunization policies, potentially jeopardizing decades of progress. Measles elimination, defined as containing outbreaks within a year, was achieved in the U.S. in 2000 and across the Americas by 2016. This milestone now hangs by a thread. Pre-pandemic, about 94% of people in 33 states received measles vaccines. But that figure dropped to 91% post-COVID. This decline matters catastrophically because measles is uniquely transmissible. One infected person can spread it to 12 to 18 unvaccinated individuals. With summer travel peaking, the risk amplifies as people carry the virus between communities. International journeys pose special hazards, but domestic movement is equally concerning, given the patchwork of low immunity zones across the country. The Texas outbreak exemplifies the danger. Beginning in January 2025, it infected over 700 people and claimed 2 lives, largely fueled by kindergarten vaccination rates as low as 77% in Gaines County. This became a cross-border crisis, spilling into New Mexico, Oklahoma, Kansas, and Mexico. Globally, the situation deteriorates too. Europe reported its highest measles caseload in 25 years this March, while Canada and Mexico each tally over 2,500 cases by July. Yet, in a contentious shift, U.S. policymakers withdrew support from international vaccine initiatives like Gavi and the WHO, undermining worldwide containment efforts. And this is the part most people miss. Such global pullbacks don't just harm other nations. They boomerang back as imported cases threaten American communities too. Herd immunity requires 95% vaccination coverage to protect vulnerable groups like infants under 1 year old or those with medical exemptions. Pediatric infectious disease specialist Tina Tan emphasizes, with plummeting immunization rates and growing susceptible populations, travel becomes a conduit for measles to jump regions. Computer simulations reveal that at current 90% vaccination levels, measles could become endemic again within 2 decades. Nathan Lowe, a Stanford epidemiologist involved in the modeling, clarifies even slight improvements in coverage could reliably prevent this, but further drops guarantee it happens sooner. Vaccine skepticism isn't the only pressure point. New appointees to the CDC's Immunization Advisory Committee have downplayed measles severity and propagated misinformation despite its proven dangers. Walter Ornstein, a veteran vaccinologist who helped eliminate measles initially, laments, "I fear we're at real risk of losing our elimination status." When nearly 90% of this year's U.S. cases originated domestically, not from travelers, it signals systemic vulnerability. Does the U.S. prioritize short-term political narratives over evidence-based public health? The data suggests complacency now could reverse one of modern medicine's greatest achievements. As Ornstein starkly concludes, supporting global immunization is a win-win. Ignoring it risks everyone. What steps would you take to rebuild vaccine confidence in your community? Share your solutions below.